My name is Dr. Meghna. I have 10 years of experience. I'm from Bangalore.
Okay.
I'm running my own clinic. And when I started this PBPA protocol, so I know that जब मैडम ने बैक प्रोटोकॉल दिया था तभी मुझे एक पेशेंट आया था बैक पेन का, ऑनलाइन आया था. सो आई डोंट नो कैसे करना है, कितना रिपीटेशन करना है, क्या करना है, मुझे कुछ भी नहीं पता था. लेकिन वो जो क्वेश्चन आंसर है वो मैंने रीड किए थे, तो उसमें मैडम बोलते रहते इतना कराओ इतना कराओ. सो आई गो थ्रू इट. एक वीक आता था तो मैं वेट करती थी कि अभी आएगा अभी आएगा. आई गो थ्रू इट, आई गो थ्रू इट, आई गो थ्रू इट. उस पेशेंट को 1 साल से बैक पेन था, उसने काफी फिजियोथेरेपी करवाया था, सब करवाया था, लेकिन मुझे ये पता ही नहीं था कि क्या होने वाला है. लेकिन आई स्टार्टेड ब्लाइंडली और उसको इतना अच्छा रिजल्ट मिला कि उसने सामने से इतना अच्छा रिव्यू दिया. अदरवाइज आई हैव टू आस्क फॉर रिव्यू दैट यू जस्ट गिव. लेकिन उसने बोला कि इतनी एक्सरसाइज आप लाते कहाँ से हो, लाइक दैट. न्यू एक्सरसाइज एंड ऑल द थिंग्स. एंड रिसेंटली मेरे 2 पेशेंट थे कि दोनों, एक नी आर्थराइटिस का था, उसने ट्रैवलिंग किया था एंड सडनली उसको सीवियर पेन स्टार्ट हो गया. ऑर्थो के पास गया, उसने बोला कि इमीडिएटली सर्जरी करवाना है, लेकिन वो रेडी नहीं था. देन ही कंसल्टेड मी. आई टोल्ड दैट आप इस प्रोटोकॉल के साथ जाओ, यू विल फील बेटर श्योरली. और वो इस तरह से गए. 1 वीक का मशीन ट्रीटमेंट लिया, 1 वीक फिर एक्सरसाइज स्टार्ट किया, नी प्रोटोकॉल. फिर वो उसका स्वेलिंग भी कम हो गया और वॉकिंग में भी पेन कम हो गया. और ऑर्थो ने लिख के दिया कि अभी जरूरत नहीं है, इन फ्यूचर अगर जरूरत पड़े तो just come and go through the physiotherapy.
Wow,
First thing, recently, last month, both of from last month only. Then एक डिसलोकेशन का था, शोल्डर डिसलोकेशन. 3 एपिसोड आए थे बैक टू बैक 2 मंथ्स में. तो वो बोल दिया था कि नहीं सर्जरी ही करवाना है, लेकिन आपको अगर ट्राई करना है तो फिजियोथेरेपी कर सकते हो एंड थोड़ा फंक्शन में मूवमेंट में थोड़ा ध्यान रखना. तो वो लोग फिर से मेरे पास आए, मैंने बोला जस्ट गो थ्रू दिस प्रोटोकॉल. वो गए और उसने भी लिख दिया कि नो नीड ऑफ सर्जरी नाउ, जस्ट गो थ्रू द फिजियोथेरेपी. आई वाज सो हैप्पी. किसी के मींस उनकी स्माइल देख के मुझे इतना अच्छा हुआ कि यस मैंने कुछ किया उन लोगों के लिए. दैट्स इट. मनी इज नॉट मैटर कि मनी तो कोई भी सर्विस करोगे वो मिल ही जाने वाला है, लेकिन उन लोगों की जो हैप्पीनेस थी वो देख के मैंने आपको याद किया था मैम. थैंक यू सो मच. थैंक यू सो मच.
Great.
Yeah, for everything.
So you know that satisfaction itself is very different actually.
Yes.
Okay. So you have a clinic. How is it? You I mean, आपका clinic है या how?
Actually, it's a polyclinic. So I'm giving 30% to them with every patient like that.
So somebody refers there, or how is it like?
No refer. Directly they come.
They come
from
directly.
Google reviews and all the things. अभी रिव्यूज भी अच्छे आ रहे हैं लाइक दैट कि बोल रहे. और वो लोग दे रहे. पहले क्या था कि हम बोलते थे अच्छा भी हुआ तो भी वो लोग लाइक देना है नहीं देना है लाइक दैट. बट अभी वो थोड़ा स्टार्ट हो गया रिव्यू का भी. सो
राइट,
दिस इज ऑटोमेटिकली
या वो सामने से बोल रहे कि नहीं वी विल गिव लाइक दैट.
करेक्ट. सो जहाँ पे नहीं मिलता है वहाँ पे पूछना भी है. ठीक
है सर. कभी कभी ऐसा होता है कि वो उन लोगों को मीन्स रिजल्ट भी मिल गया होता है, लेकिन आई डोंट नो कि वो भूल जाते हैं कि क्या है, तो वो नहीं देते. तो शुड वी गो विद मींस दूसरी बार पूछना चाहिए उनको रिव्यू के लिए कि
पूछो ना क्या प्रॉब्लम है, पूछो. ओके, टेल देम कि आई एम एक्सपेक्टिंग योर like a learning experience or share your feedback as such. Okay, so how see, one thing is you asking, right? Second thing, you need to tell them why it is necessary, right? Because the people, many people like you who are facing similar issues, right? So today they do not know what is the right treatment for that. Okay, so that's the reason they keep on going here and there. Okay, and if you are able to help someone by sharing your experience, then don't you think it will be helpful, right? So
yes,
what
right,
goes around comes around. It is as simple as that, right? So tell them the importance of the gratitude. Tell them the importance of when you help something, probably tomorrow you may need something. You do not have that. Abhi usko पूछो चाहे तो कि you also must have seen somewhere, right? About my protocol या ये हो गया या review हो गया. So by that you automatically get some kind of a trust. So that it helps them to give that right direction as such, right? So देखो ये तुम्हारे अच्छे के लिए नहीं है, ये तुम्हारे पेशेंट्स के लिए अच्छे के लिए है। तो जो तुम्हारे पेशेंट्स के लिए अच्छे के लिए करना है वो सब कुछ करना है आपको, राइट? डोंट थिंक it's for your sake. Okay, your patient will get the better
Even
direction.
the same person came by seeing the review only.
Right?
Yes. Nowadays it's like this only.
So always think from the patient angle कि नहीं ठीक है मुझे चाहिए, but ये किसके लिए चाहिए? What is my purpose of asking? Okay, is the purpose is to help other patients to get the direction? Yes, ठीक है, then do it, right? अगर वो देना नहीं चाहे ठीक है, okay, it is left to them.
Yeah.
ठीक है, but अगर नहीं दे रहे हो, unconsciously नहीं दे रहे हैं तो ये करो, जैसे मैंने भी आपको पूछा हुआ है, right? You know, I also have many a times, you know, मैं ask कि दो, क्यों दो? क्योंकि other physios will get that direction because you never know, right? कि what you have learned in that. Okay, for Arusha, okay, the learning was something different. For you, the learning is something different. For others, it may, and their perspective, right? And you know, मैं शायद 10 वर्ड बोलूंगा, 100 वर्ड बोलूंगा, आप में से शायद एक वर्ड भी आ जाए और वो वर्ड से वो कनेक्ट हो पाए,
अफेक्ट कर सकता है. Yes.
So you know, it's great, right? That's it.
Yes.
Good. So what are the transformation that basically took place, you know, between in you in this 4 months as such?
Yeah, I'm become very confident that I can say to the patient that yes, I can avoid the surgery by exercise. This is the main thing I can say, right? कि पहले इतना नहीं था कि एक्सरसाइज से हम सर्जरी तक अवॉइड कर सके, ऑर्थो ने लिख दिया है फिर भी हम चैलेंज ले सके, वो नहीं था. लेकिन बाय आफ्टर दिस प्रोटोकॉल मैंने तो अभी कंप्लीट किया है, लेकिन मैं तो पहले से सेकंड मंथ से ही मैंने स्टार्ट कर दिया था, तो उसमें भी मैं इतना कॉन्फिडेंट हो गई थी बाय सेकंड मंथ ओनली. सो दिस चेंज, आई थिंक दिस इज द मोस्ट वंडरफul change for me.
So you know, you must have gone through the other workshops also, right? Okay, so when you are comparing this workshop and others, do you find some difference ki, you know, why here actually the outcome came?
Yes. So I don't know. Yes, many courses means dry needling, cupping, tapping, all the things, but उसमें क्या था, means they are not giving full content, means कुछ ना कुछ रह जाता था कि ये करना है, सिर्फ सिंपली एक ये करो, that's it. लेकिन by this workshop, this your workshop, इस एक कोर्स में ही we are getting everything which are searching for long, right? कि जो हम ढूंढ रहे थे कब से कि कैसे हम पेशेंट को पूरी तरह से ट्रीट करें, वो एक ही कोर्स में सब कुछ मिल जा रहा है. So this is the best thing कि अभी किसी कोर्स की जरूरत नहीं है, like that.
Right. So it is about connecting the dots, right? कि you know हर एक you know अगर जब आप connect करोगे तो डिजाइन बनेगा ऐसे, right?
Yes.
Good.
So
but make sure guys, you know, you must think from the physiotherapy angle also. Okay, कि जो physiotherapy है वही करो, right? Do not please confuse your patients. Do not you know, just because some course is coming, just because something is coming in, okay, you don't need to rush in, right? You don't need to rush in, right?
Yes, पहले मुझे भी यही था कि नहीं मुझे करना पड़ेगा, ड्राई नेडलिंग भी मुझे करना पड़ेगा, ये भी करना पड़ेगा, like that. I was not aware of this, no. So पहले ट्रीटमेंट के साथ ये भी मैं करती थी, लेकिन अभी मैंने छोड़ दिया है. I'm just focusing on only and only this baby protocol. That's it. Nothing else.
Right. See, you know, you don't need to be an, you know, क्या बोलते हैं उसको, herd mentality as such. सब लोग भाग रहे हैं, भागने दो, ठीक है ना? You know, we need to have that clarity कि you know when this is there, a complete solution is there, okay, then rather help others, okay, not to just get into a herd mentality as such, okay, because कोई अच्छा कर रहा है और दूसरे गंदे कर रहे हैं तो फिर वो गंदगी फैलती जाएगी ऐसे, okay. So we need to make sure that you know maintain that physiotherapy का जो core principles है अपने पास, ठीक है, and you know that needs to be maintained as such, okay. Every 6 months don't mix करके उसको इतना ये मत करना, ठीक है ना? Good. So in terms of a patients, okay, number of patients as such, okay, so how is it like earlier and this now?
Yeah, it increased actually. Means पहले क्या था कि एक वीक के लिए मैं ज्यादा से ज्यादा बोल सकती थी, और वो भी एक वीक या 10 डेज, मैक्स टू मैक्स 15 डेज। लेकिन अभी जो भी मैं पेशेंट ले रही हूँ, मोस्टली दे आर गोइंग विथ 30 डेज, 28 days, 1 month full. So number of session increase. So this much content we have now. And yes, due to that, all over the per day patient is also increased because of they are coming for a longer period of time, right? So
double, triple, 4 times, what is it? अगर देखा जाए तो
yeah, 4x.
4x. Good. So similarly, revenue also increased to 4x.
Yes, 4x. Because I'm about to reach 1 lakh now.
1 lakh.
About to. Not
Good.
reached now, but yes, I'm hoping next month.
But we need that news. Okay, so
Yeah, sure, sir.
okay,
Yes,
you should share that. I have now crossed 1 lakh. I have reached. I have crossed whatever that is things. Okay, and from there on, you should have the targets also. Don't just be stagnant over there, right? My thing now. अगर 1 हुआ है तो now I need to increase it to 1.25. Okay, then 1.5, 1.75, 2, right? 2.25, and उसके लिए जो लगेगा, okay, वो अपने को करना है, ठीक है? You need resource, you need people, you need anything as such. Okay,
So
whatever
you are
you
working
need.
full time or how is it? Or
yeah, it's like full time only, 9 to 1 and 4 to 8, like that. Okay. So if in between patient is there, I'm going.
Okay. So you're married or you're
yeah, I'm married. I have a 2 years old baby.
Right, good. So how is the family experience now? 3 months, 4 महीने पहले शायद you were working between 20 to 25.
नहीं, वो भी बोल रहे हैं कि काफी पेशेंट बढ़ रहे हैं, तुम बिजी हो गई हो.
Because that's your responsibility, right? Because I'm divided, right? Because due to my professional ethics, due to my professional things, I have to give the time for a family also. And
yes. नहीं, वो बोल ही रहे हैं कि तुम काफी बिजी हो गई हो अभी nowadays.
Good.
नहीं, but तो एक ठाट भी बनती है ना ऐसे, हाँ बिजी भी हो गई.
वो अच्छा लगता है.
Enjoy that. Okay, and even again, it is a suggestion for all of you that in case if you get to see any kind of an award programs like Arusha said, right? Somebody called her for an a speaker as such. Okay, so try to see such kind of an opportunities also, right? Be it award or be it, authentic as such. Okay, and be it speaker kuch rahe ya opportunities dekho wherever where you can get the exposure, right? Visibility jahan pe dikhta hai na, वहां पे फोकस रखो. एंड because now you are experts, now you have the content what to speak, now you know what is right and what is these things, and you have most important is a clarity, right?
Yes.
Now it's your responsibility that yes, you be available for a larger crowd, larger mass as such, right? And face the larger audiences as such, right? So when you face it, then and a different kind of a confidence level altogether will come in, right? So try to be participative in community gatherings or sort of Lions Club का meetings होते हैं, या where the social gatherings takes place, events कुछ हो सकता है, या even lot of अपने conferences, IAP conferences like regional conferences होते हैं आपके, Bangalore के हो गया, इसके हो गया वगैरह. So make sure that you submit your nomination for an award and everything, right? So because unless you submit, you won't be able to understand what actually you have worked, right? So when it comes into paper, then you'll be able to understand, right? And if you are getting good knowledge, okay, I would rather recommend to go for an L3 also, okay, because it is required. Okay, it is required. Now for this case, RA case ho gaya, ye case ho gaya. Not just that, but you must go deeper. Okay, you must go deeper to see, when you go deeper, you'll be able to build a better wealth, right? Yes. The depth of knowledge increases your width of your wealth as such, right? Yes. That is the reason. Make sure that whatever is required for you to grow, okay, it has to be done. Okay, and you should be able to face anyone, okay, because we come across musculoskeletal doctor or neuro doctor, peds doctor or gynae doctor and everything as such. So when you speak that confidence, okay, like जैसे कि मैं आपने बोला अभी कि patient का satisfaction maximum satisfaction देता है. So similarly, when people look at you with these things, being a physiotherapist, she's speaking to an ortho, she's speaking to a neuro, she's speaking to peds. जबकि हम लोग वो नहीं कर पाते and they have that knowledge, right? So you should build that authority in your domain as such, right? So दूसरे नहीं कर पाते हैं, that is an additional advantage for you guys for move faster, right? So दूसरे आए उससे पहले आपको 10 कदम आगे और चढ़ जाना है, right? So when we started, we always think what is next 10 years, ठीक है? 10 years के ahead के काम हम लोग आज शुरू करते हैं, so that none of the people will not be able to think on reaching part actually, right? So you also need to have that thought process as such, and should be able to do that. ठीक है ना? Okay, so
And,
good.
where do you have clinic, Meghna, in Bangalore?
Whitefield area.
Whitefield.
Whitefield area. Okay, yeah. Good. I think we have a lot of patients also there. My network is very strong in Whitefield actually because of being an IT area as such. Okay.
Yes,
so
IT area,
yeah. So we have a huge network over there. So I'll definitely give you a reference. Okay, this thing. Okay, in Bangalore. No problem as such, right? So thank you. Anything you want to share? Why one has to join the level 2 program also?
Yes.
Level 2 program as such, or they should not join?
Don't think and go for it, because I'm feeling that I'm very too late to join this course. So don't wait, guys, and go for it, because it will give you the whole the things what you are searching for long. Okay, so please go for it. Yeah.
Okay, good, Meghna. In fact, that's what very important point. You suffered for 10 years. You have seen that burning out, right? Okay, so when it is a burning out, it is not only a professional burning out, right? You have personally suffered, right? It's a personal burning, it's a professional burning, it's a career burning. It's a lot of stress as such. Okay, so they have the chance. Okay, the people who are the freshers or the people who have just started. Okay, so they can reduce that.
Right.
Okay.
Right.
So thank you so much.
Thank you so much.
Yeah, best luck for your
Thank you.
growth. Yeah.
Thank you so much.
Yeah.